Okay, it's now 10 past 10, and good morning again to all delegations joining. I see the number is still ticking upwards, so I hope that we will be even more colleagues joining in the coming minutes. But let's start now. My name is Ulf Björnholm. I'm Deputy Director of Governance Affairs Office of UNEP, and it's my pleasure to just open this meeting, which is a Secretariat briefing, a Secretariat webinar, which is actually part of a revival, in a way, of a tradition practice we had before COVID, where the Secretariat regularly did provide updates and shared information on certain work streams for interested delegates. These are open-ended meetings, so any CPR member or even a capital-based UNEP a delegate or representative could join. And typically the purpose of these meetings is just to provide information and updates on important projects and work streams and program. We have decided now to see if we can reinitiate this practice, but we will have these meetings taking place fully online, and we hope to capitalize and benefit from the progress that has been made in terms of organizing online meetings during the past 2 years. And so today we will look at the One Health approach, and as you may be aware, UNEP has recently become part of the Tripartite, which is now Quadripartite partnership on One Health, together with the FAO, WHO, and the World Organization for Animal Health. And we have a program which we distributed with the invitation. We will hear from our Chief of Biodiversity and Land Branch from the Ecosystem Division, Ms. Doreen Robinson. She will provide opening remarks and moderate this webinar. And then we'll also hear from other colleagues, I think, in UNEP, and also from our partners in this Quadripartite partnership, specifically on a presentation on a joint plan of action on this One Health approach. So this presentation will take maybe somewhere around 40 minutes or so. Then we will open the floor, led by Doreen as moderator, to discuss and have a question and answer session, and to try to respond to any questions that may be coming up from delegations after the presentation. And then there will be a kind of a summary intervention as well from Doreen, and also looking forward towards the next step and closing remarks. So that's the setup, and with that, I'll just quickly hand over to Doreen, who will lead us through this webinar. Thank you.
Thank you, Ulf. Can you hear me?
I hear you very well. And
okay,
I suggest,
so
I hope that the participants will as well. Yes. Thank you.
Wonderful. I'm always happy to be part of restarting best practices. So very happy to do that. So as Ulf said, I will be quick because we have a presentation we want to make, but we are here to talk about One Health. I'm sure there's a slide where you're going to see our new and improved definition of One Health, but it really is about taking an integrated and holistic approach that looks at the interdependencies of human, animal, and environment health. You cannot have one without the other. And so just as a reminder, as many of you know, One Health is in our current MTS, and it really is a concept that cuts across all of the 3 pillars of nature, climate, and pollution. It's about working in complex systems to improve benefits for, as I said, human, animal, and ecosystems. We do have a resolution 3.4 on environment and health. And that was really focused on chemicals and waste, climate, biodiversity, and AMR. And then at our last UNEA meeting, we have resolution 5.6, which is focused on biodiversity and health, but it also restates and refines some of what came out of Resolution 3.4. And as Ulf said, it was March 17th, 2022, we formally joined the Quadripartite. And the significance of that is really giving environment an equal seat at the table. I think it has been recognized. One Health has been a concept that has been around for a very long time. Some will say it dates back hundreds of years to an integration of veterinarians and medical doctors. But certainly in the 2000s, One Health as a concept really took off. But the environment dimensions were really lagging behind. And this is really what UNEP's interest has been. So it got, of course, COVID. Its origins being in a zoonotic disease gave One Health a fortunate and highly unfortunate sense of attention from the global community. And that's really where UNEP's new journey started in the Paris Peace Forum in 2020 was the first meeting where the principals of the 4 organizations met, and Ingrid was invited to join the tripartite, now quadripartite at that time. And between that time and now, and when we joined, we've been working very closely. And our history of working with these 3 other organizations is long and deep. But really, since the Paris Peace Forum in 2020 to where we are today, we've been deepening our analysis and our collaboration and looking at really ways where we can bring the value addition of the 4 organizations. The other thing that's recently happened that we are not going to discuss today, but I do want to mention it, is with the generous support of Germany, UNEP has received 50 million euros, which we have put into a multi-partner trust fund to focus. It is a fund we are now calling the Nature for Health Fund, and that is really a fund to work on operationalizing this approach on the ground in up to 20 countries, where we will be looking at upstream investments in nature and climate to prevent epidemics and pandemics, and really how we can focus on ecosystem-based approaches that can prevent and minimize, or at least help to manage health risks. So that we're in the inception phase and it's just starting, and there's plenty more to come on that. But today, what we're going to talk about is what we've been doing with the quadripartite organizations to really figure out what are the things that we should be doing together that can help, again, address One Health concerns, help reduce and manage risk, and also bring out the value addition and the synergy across the 4 organizations. This was presented in the quadripartite annual meeting, which was held in March. It was presented to the 4 principals of the organizations who endorsed for the work to continue to go forward and endorse the plan in principle, but we recognized that we needed a bit more time to tweak it and refine it and do some of the analysis and thinking to make it better and stronger. So today, what you'll hear is what is involved in the plan, what we plan to focus on, and our hope is that that we will have a detailed implementation plan against it, and that we will launch this plan and finalize it next month. As much as any living adaptive document can be finalized, because One Health is an evolving concept, and so we know we need to be more nimble and flexible and adaptive as we approach to both the opportunities and challenges it presents. So you'll hear from, I'm not sure, I think we had some time zone issues. So the plan was at least 3 of the 4 organizations were going to co-present with UNEP. We'll see, Julian's got it all masterfully worked out. So we'll see who shows up to present, but then we'd love to have an opportunity to get feedback, questions, discussions from you all that can inform the finalization of this plan. So with that, I will turn it over to Julian to lead us through the presentation.
Thank you very much, Doreen. Yes, and I'm not sure how masterful this is, because indeed there are some presenters that I don't see on the list right now, but if they're not here, I will present on their behalf. So let me just share my screen. And if somebody could confirm whether you can see it in presentation mode. Doreen, can you see it, or Ulf?
Yes, we can see it, and you.
Great.
Very well.
Thank you very much.
Go ahead.
Thank you. Okay, so as Doreen has already introduced, so I'm going to be telling you, or those of us who are able to join, be telling you about the quadripartite joint plan of action for One Health. And let me see if this works. Okay, so just by way of background, so I mean, as you all know, and as Doreen alluded to, One Health already, of course, high in the international agenda, but obviously COVID-19 sort of brought it even higher on the agenda. Already back in 2021, before UNEP formally joined the now quadripartite, at the 27th annual executive meeting, the executives of the then tripartite agreed to jointly develop a strategy and action plan to prevent future zoonotic pandemics through a One Health approach. This was reinforced by a World Health Assembly resolution 74/7, which requested WHO to build and strengthen on the existing cooperation of the 4 organizations to develop options and for consideration by the respective governing bodies, and establishing a common strategy on One Health, including a joint work plan to improve prevention, monitoring, detection, control, and containment of zoonotic disease outbreaks. So a drafting team was convened, and you will see a more detailed timeline of how this was developed later on, back in June 2021. And then we worked for several months. It was a joint drafting team from all 4 organizations, and a draft was presented to the now quadripartite executives back on the 17th of March, and which was also the day in which UNEP formally joined the collaboration, and it became the quadripartite. So the whole action plan, which we're going to be telling you about, rests on the definition of One Health, on the new definition of One Health, which again Doreen has referred to, and this was developed by OLEP. OLEP is the One Health high-level expert panel, and as Doreen also said, it really brings the environment up to the same level essentially as the human and animal health, and it collaborates it corroborates or highlights the importance of working across sectors, across disciplines, and also across multiple different levels of society. And it has to help and apply to rural communities, urban mobilities, nomadic communities, etc., based on principles of inclusivity and access. The 4 core principles or mechanisms for operationalizing One Health are communication, collaboration, coordination, and capacity building between all those disciplines and sectors of society. And that the theory is, of course, that it will lead to the appropriate implementation of One Health, leading to healthy ecosystems, healthy humans, and healthy animals. So in the context of this action plan, of this plan of action, is that there are, of course, and we know this very well from the environment side, many multidimensional health, water, energy, food security, and biodiversity challenges, which require that cross-sectoral collaboration, coordination, and communication, as well as capacity building. There is, of course, and partly because of COVID, increasing political commitment and international support for the One Health approach. And this presents a unique opportunity for the 4 organizations to stand together as a global coalition with a common voice to jointly drive the change that is required and all the transformations that are required. So this One Health joint plan of action aims to strengthen a comprehensive One Health approach and to foster synergies and change pathways required for mainstreaming One Health at all levels. So the action plan itself has 5 parts. The first one sort of sets the scene, and it basically talks about the important, well, it starts actually with the One Health definition. The environment, as you can see there on the screen, is right up front there. The importance of the interrelationships between the health of the environment and the health of people and animals and plants is stated clearly up front. And then it sort of goes into other topics like emerging infectious diseases, such as COVID-19, now monkeypox that we're hearing about, the persisting burden of endemic zoonotic, neglected tropical and vector-borne diseases, such as malaria or trypanosomiasis, etc., and the global upsurge in food and water safety hazards, as well as the growing threat of antimicrobial resistance, which, as you know, this is an area where UNEP had already been collaborating with the tripartite, going further before we had sort of more fully started collaborating on other aspects as well. So the the second part really lays out the theory of change and the action framework of the action plan and its guiding principles, what it intends to do. And then it's in the third part, it's devoted to 6 different action tracks. That's going to be like the meat of this presentation today. Those 6 action tracks are about enhancing One Health capacities at all levels, reducing the risks from zoonotic, emerging and re-emerging zoonotic epidemics and pandemics, controlling and eliminating neglected tropical diseases, strengthening the assessment, management, and communication of food safety risks, as well as curbing the silent pandemic on AMR, and then integrating the environment into One Health. The fourth part goes into governance, implementation, and monitoring of the action plan, and the fifth part is about financing or investing and mobilizing resources for One Health. So here you see just the same action tracks in a diagram, and maybe here I'll just point out that although, as you have already seen and heard, there is an action track on the environment, the environment is integrated into all the other 5 action tracks. It's just that because the environment hasn't traditionally been fully integrated into One Health in the past, we felt it was important to have a dedicated action track to try and rebalance or bring up the capacities and understanding of the environmental linkages across the One Health disciplines. So the overall, the One Health Joint Plan of Action aims to be a collaborative and participatory effort amongst the 4 organizations, and it provides a framework for action, and it proposes a set of activities in each of the action tracks that the 4 organizations can offer together to advance and sustainably scale up the One Health approach. So it is a framework, a guiding framework. It's not a binding policy document, okay? So it's just a guidance, if you like. So it uses the One Health approach, as we've talked about before, to strengthen collaboration, communication, capacity building, and coordination equally across all sectors responsible for addressing health concerns at the human, animal, plant, environment interface, or interfaces, because there are multiple. So it also builds on existing One Health initiatives of the 4 organizations. So it doesn't try to reinvent the wheel, but actually to create those synergies. And it also provides scope to take stock of global and regional initiatives that may be going on elsewhere, to identify and advise on synergies, overlaps, and support coordination. And it also foresees the need for resource mobilization, but aims to make good use of existing resources across sectors and stakeholders. Again, looking for the synergies on existing initiatives. The theory of change, it's here. I mean, I don't expect you to look into it in detail. Of course, as the action plan itself was shared in the meeting invitation, so you should have all received it and should be able to read it. But essentially, the theory of change, the impact it's trying to achieve is a world better able to prevent, predict, detect, and respond to health threats and improve the health of humans, animals, plants, and the environment while contributing to sustainable development. So that would be the ultimate impact, and that is given by the long-term and medium-term outcomes, which I'm not going to go into detail, but because you can read from the action plan. But basically, just to emphasize that those outcomes would be achieved, well, through the activities in the action plans along 3 different pathways, which go along the lines of policy. The first pathway is policy, legislation, advocacy, and financing. The second one is about organizational development and, of course, capacity building, implementation, and integration across sectors. And the third pathway is on data, evidence, and knowledge. Okay, so this is the promised timeline. So as I said earlier, this process started in early June of 2021. And we basically worked this drafting team that I mentioned, divided up into the 5 action tracks and regular coordination meetings, worked together over the sort of the second half of last year. And then the draft was circulated internally for comments and updates, et cetera, essentially leading up to the actual presentation of the draft to the meeting on the 17th of March of the executives of the Quadripartite, where it was approved in principle. Going forward from here, the plan is, well, now we are in the process of introducing these the action plan. Each of the 4 organizations is introducing it to their constituencies, as we're doing here for the UNEP constituency today. And the plan is to finalize and officially launch the plan in June this year, so next month. And then we will establish a joint task force to basically develop a detailed implementation and rollout plan that would essentially drill down to the national or regional context, because context is important. You don't need the same interventions in every place. So, the implementation has to be tailored to the local needs, as well as also to develop a joint resource mobilization strategy, tools for implementation, etc. Okay, so now we're going to move on to presenting the action tracks, each one of them in a bit more detail. And here, this is where the first of our presenters, Barbara Alessandrini from the World Organization for Animal Health, is expected to present. I'm not sure, I cannot see now the list of participants. So I don't know if Barbara is here, and if she is, whether she's enabled as a presenter. But maybe somebody can check and confirm, and if not, I will present. I know that OIE is having their assembly this week, but Barbara did say she would be able to join.
I do not see Barbara.
Okay, all right. So then I'll kick in to present action track 1. So the main objectives of action track 1 is to strengthen One Health capacities in health systems through guidance, methodologies, and tools. And here by health systems, we're not just talking about the classical health systems of the medical health system and the veterinary health system, but of course also the environmental health system. The second objective is to assure effective implementation of multi-sectoral approaches in promoting the health of humans, animals, plants, and ecosystems. And the third one is to prevent and manage the risks at the human, animal, plant, and environment interface. So those aims are basically implemented, again, with the One Health definition as the central concept, along the sort of three lines of work on establishing the foundation for One Health capacities, and that requires and involves systems thinking, conducting needs assessments, again, bringing things down to the context level, to the different contexts, carrying out joint planning and prioritization of required interventions. The second stream is on One Health at work, which is developing essentially One Health workforces, and that requires capacity building, operationalization, resources, tools, mechanisms, and again, building on what is already there, but also where needed, developing new approaches, tools, and methods. And the third stream is about the enabling environment, and that requires monitoring, implementation, enforcement, sustainable financing, appropriate information systems, communications, and transparency. This action track, of course, as all the others, is aiming to build on existing programs and initiatives. So on those three streams, on the foundational stream, we have the tools that were developed by the Quadripartite, like the tripartite, by the tripartite, not by the Quadripartite, because this goes back like the tripartite zoonosis guide, the WHO multi-sectoral coordination framework, the OIE tools for public veterinary services, the international health regulations, and public veterinary services national bridging workshops, which are conducted jointly by OIE and WHO, the Global Strategic Preparedness Network, the OIE Observatory, etc. The same goes for the second stream, One Health at Work. The FAO, the tripartite, had developed the sort of a framework for strengthening capabilities for veterinary epidemiology and biosurveillance, global laboratory leadership program, training and academies and programs and collaborating centers that across all four organizations, OIE and its public-private partnership tools, etc. And on the environment, enabling environment, again, we have the all One Health platforms that exist in countries at regional levels, legal technical assistance programs of different organizations, and financial and funding mechanisms that may already be there. So that's the overview of Action Track 1. And now we'll move to Action Track 2, which is going to be presented by Johannes Riffisch from UNEP. And I hope, Johannes, you already have presenter rights. If not, maybe Isaiah can provide.
I think we're okay, Julian. Can you hear me clearly?
Yes, absolutely. Thank you.
Okay, great. Thank you. Yeah, pleasure to present Action Track 2 on behalf of the group, reducing the risks from emerging and re-emergent zoonotic epidemics and pandemics. We have identified 3 main actions under Action Track 2, and the first is understand driver of emergent, spillover, and spread of zoonotic pathogens. We often think we know all, but unfortunately we do not know all, so more understanding is needed, especially in identifying risk factors, drivers, processes, and pathway. Often we don't know baselines, define baselines and monitoring frameworks, develop standard protocols, establish research agenda, and work on the science policy interface. So based on this, Action 2 will identify and prioritize targeted, evidence-based upstream interventions for prevention. I'm giving you a few examples of more specific activities. First, identify feasible, acceptable, and sustainable interventions, raise awareness, provide tools, guidance, regulatory frameworks. We also have a few ingredients which are needed for Action 2. That means the prioritization of nature-based solutions and the incorporation of indigenous peoples' knowledge. Also establish standards for the management of ecosystem processes. And finally, Action 3 will focus on strengthening national, regional, and global One Health surveillance, early warning, and response systems. More specific activities under that action include to conduct One Health surveillance, predict risk factor, occurrence, and abundance, identify high-risk interface and hotspots for spillover, One Health's pandemic risk assessment data sharing, progressive control and management pathways, innovation and new technologies. Next slide, please. One back. Yes. So with these 3 actions, we hope to build on existing initiatives. And I want to mention a few. One is the One Health Intelligence Scoping Study, OHISS, under the G7. Also the One Health High-Level Expert Panel, which has already given us a lot of guidance and will give us more guidance on the design of One Health surveillance systems. Another important tool is the Surveillance and Information Operation Tool, SISOT. And finally, also the WHO One Health Intelligence Hub to be created in Berlin. So with this, I end on Action Track 2 and I hand over to Action Track 3. Thank you.
Thank you very much, Johannes. Okay, so this Action Track 3, which is on controlling and eliminating endemic zoonotic, neglected, tropical, and vector-borne diseases, we are hoping and expecting that Bernadette Abela-Rieder from WHO has been able to join. Can I check again whether Bernadette is online? And if not, I will present this action track. Maybe Johannes or Jewel, you can have a look. Yeah.
I don't see her.
Okay, well, there we go. Okay, so the objective of this action track is to reduce the burden of those endemic, zoonotic, neglected, tropical and vector-borne diseases by supporting countries to implement community-centric and risk-based solutions, strengthen policy and legal frameworks from local to global level and across sectors, and increasing political commitment and investment so that these diseases are no longer neglected and actually addressed appropriately. The actions in the action track, there are 3 of them. About the first one is to enable and empower countries to develop and implement community-centric and risk-based solutions, involving in a participatory way all relevant stakeholders. The second one is about ensuring the harmonized application of One Health principles at all levels, again, all the way from the community to the national and international systems. Implementing practical measures to strengthen policy frameworks at all those levels. And the final action is about increasing political commitment and investment by advocating for and demonstrating the value of a One Health approach. Okay, so with that, we move on to action track 4. And once again, I ask, this was supposed to be presented by Dr. Simone Moraes from WHO, and I'm not sure if she managed to join.
I'm here. Yeah, I'm here. Hi, everyone.
Great.
Good morning.
Thank you.
Thank you. Yeah, so I will present on action track 4 that is related to food safety, is strengthening the assessment, management, and communication on food safety risks. If I can have the next slide, please. Okay, so what's the aim of the action track on food safety? It's basically to reduce the burden of foodborne disease. We now, nowadays, based on the data available, we have almost 1 in 10 people fall ill because of foodborne diseases. And we lose 33 million health life years because of the burden of foodborne diseases. The most affected group is children under 5 and people with immune system compromised diseases or other underlying conditions. So the objective is to reduce this burden and to have more people healthy and not dying or falling ill because of foodborne diseases. If you click on next, please. Okay, so then the actions on this action track 4 are based on food safety risk assessment, food safety communication, and food safety risk management, which are the 3 components of the food safety risk analysis. And how we do that, if you go to next slide, please. The action track has 4 main areas. The first one is to strengthening the national food control systems through One Health approach in the national control systems. We all know that national food control systems are a good example of One Health approach. They are multisectoral. We need to understand all the components of human, animal, plant, and environmental health. So this action track aims to strengthening the One Health approach and the national food control system, to leverage data, scientific evidence, and risk assessment for improved policy making and risk management decisions. We needed to generate and share data, but also to be able to interpret and understand the data that's being collected. In this case, there's also a very good relation with the human-animal interface, understanding foodborne zoonotic diseases that are emerging or new pathogens that are need to be detected, and we need to have a response for that. And the integration of national foodborne disease surveillance systems and research across One Health. So we needed to focus on these areas, on the human-animal interface and how they are affecting the food safety all over the world. And next, please. Okay, and then in this slide we are seeing the intersectoral and the communication among all the organizations of the Quadripartite. We have so many areas that we work together, that we share same goals and same projects that are all related to this action track 4. Just to mention from WHO, we are now this week we are having the World Health Assembly. We are having a new global strategy for food safety that we developed with the support of our colleagues from the Quadripartite, and that is also including the One Health approach and strengthening this multisectoral coordination among national food safety authorities. But we have the connection with neglected diseases and drug residues that are contaminating the food, and the FAUSE strategy for improving food safety globally that is also under discussion during 2022. I think this is my last slide, and I'll be, there's also the AMR, thanks, climate crisis and biodiversity in emerging zoonoses. So we have a lot of, the One Health approach is a very basis to strengthen food safety at national level. This is my last slide. I'm happy to take questions at the end. Thank you.
Thank you very much, Simone. So we move on to action track 5 on antimicrobial resistance. And I know that Tim Corrigan from WHO is here. So over to Tim.
Hello, thank you, Julian. Good morning, colleagues. It's a pleasure to be here, and I'll be presenting action track 5, curbing the silent pandemic on AMR. Thank you. So the main objective of action track 5 is to take joint actions to preserve antimicrobial efficacy and ensure sustainable and equitable access for responsible and prudent use in human, animal, and plant health. The objective and the activities in action track 5 are fully aligned with the Quadripartite strategic framework for collaboration on antimicrobial resistance and its joint work plan. So just a brief word on the framework. Its development predates the joint plan of action, and it reflects the joint work of the 4 organizations to advance the One Health response to AMR. Julian had mentioned earlier about UNEP's collaboration with AMR. We were fortunate enough that almost for the past 2 years, and since then it was steadily growing, and UNEP was fully involved in the development of this document beforehand. And similar to the JPA, it's not a policy document or a binding document, but it just really shows what the 4 organizations are doing together for the One Health response to AMR. The framework broadly supports the implementation of the 5 pillars of the Global Action Plan on AMR, the global guiding document to the AMR response, as well as strengthening global AMR governance. By linking the strategic framework with the joint plan of action, this will ensure that all of the AMR-related activities and investments are coherent and synergized across other areas of One Health collaboration. Next slide, please. So the first action is country-focused. It supports AMR control at country level, ensuring interagency coordination, technical support, and capacity development. As an example, this is where the bulk of the work on the AMR Multi-Partner Trust Fund is captured. The AMR Multi-Partner Trust Fund is a key mechanism to fund and catalyze action in countries. The second action supports coordinated mechanisms and activities to mobilize demonstrated regional political engagement and resourcing at the global and regional levels to support AMR control at country level. So this is where we have more global level activities and regional activities, such as the coordination mechanism of the Quadripartite Joint Secretariat on AMR, and also the monitoring of the implementation of the Global Action Plan on AMR. The third action covers the support provided to the interrelated governance structures that will strengthen accountability and global governance of AMR. These are namely the Global Leaders Group on AMR to accelerate political action, the Multi-Stakeholder Partnership Platform to facilitate stakeholder engagement, and an independent panel on evidence for action against AMR. So with this, I thank you, and I hand it over to Action Track 6, which I believe is Julian.
Yes, it is. Thank you very much, Tim. That's me. And the final action track is the one on integrating the environment into One Health. And the objective of this action track will sound very familiar to the constituency of UNEP, because it's about protecting and restoring biodiversity, preventing the degradation of natural resources and the wider environment to promote the health of people, animals, plants, and ecosystems underpinning sustainable development. So this basically, we feel that the protection and conservation of the environment is not just a responsibility of the environment sector. It is a joint responsibility of all sectors. So from the One Health approach, it becomes a collective responsibility as well to make sure that their activities do not contribute to the degradation of the environment. So this action track has 4 main actions. And the first one simply echoes the overall objective about protecting, restoring, and preventing the degradation of ecosystems and the environment. The second one, as I alluded earlier, is the environment had never been really fully integrated across the board in One Health approaches, and this action is trying to do just that, to make sure that there is enough understanding and sensitivity, if you like, to environmental issues and how they can affect and impact human, animal, and plant health. At all levels, of course, of policy making. The third one, again, this is part of the prior lack of full integration of the environment in One Health, is to make sure that environmental knowledge, data, evidence is integrated into One Health decision making. And that, of course, includes in risk assessments and needs assessments, et cetera, in all sorts of work. And importantly, also including the knowledge that is coming from local communities, indigenous peoples, et cetera. And the final one is about capacity building. It's about creating interoperable training programs and capacity building programs, both for the environment sector, which, you know, the fact that the environment was never fully integrated into the One Health is actually a two-way street. Perhaps in part the health sectors didn't feel it that important to be engaging the environment sector, but also the environment sector traditionally didn't feel that health of human, animal, etc., health was in their mandate. So this is about building the capacity to bridge that gap and to make sure that professionals from both sides, if you like, the environment and the health sectors, is built so that they can engage meaningfully in the One Health approach. And that's the end of the 6 action track presentations. So now I will hand over back to Doreen to manage the discussion. Thank you very much.
Thank you. So Julian, can I flag for you if it's possible? Are we able to upload the PowerPoint into the chat?
Absolutely. I can do that as soon as I take it off the screen. So I don't know if you want these things on.
Yeah, no, so this is really, so we've thrown a lot of information out there, and thank you to our colleagues from WHO. Our Action Track 1 presenter did arrive a little late, Barbara, so she's here to also help answer any questions. So there she is. And so thank you to the team. This truly, I think you can see from it was a seamless presentation despite time zone issues. This really has been a wonderful collaborative effort across the 4 organizations. And so I really open the floor to our colleagues to ask questions of any of the individual presenters, broader questions, related questions, clarifications, make any points that you would like to make, but this was really a chance to give you all an update on how we see moving closer together. The other point I wanted to make is that, you know, collaboration has costs. And sometimes you don't always need to collaborate, and you have to be very wary of the costs. And this process has really involved a lot of wonderful minds thinking together about how, by working together, that those costs will be worth the benefits. And I think you see that in the presentation. So it doesn't mean all 4 of us have to do everything together all the time. That's not the point. It doesn't mean a bunch of ecologists are going to try and get involved in primary healthcare assistance or vice versa. But what it does mean is that we put a lot of thought into when we should be doing things together or in parallel or in synchronicity to have a greater impact. So if you want to speak, here's our panelists. Feel free to raise your hand function, or if you can't figure out the raise your hand function, feel free to turn your camera on and wave to me, and I'll get your attention, or put something in the chat. I will say there was one question early up some of you might have missed. There was a question about the pandemic treaty, which is an ongoing process, and I did sort of respond to it. The pandemic treaty is not necessarily a focus of our planned joint plan of action, in part because the pandemic treaty is a member state-led process, and WHO is facilitating that process. However, I can assure you, we meet amongst the Quadripartite quite regularly around the action plan and other venues, and we do regularly discuss what's going on in things that may not be specifically in this joint plan of action and sharing information. And I think all 4 organizations are actively involved in the working groups, the open-ended working groups for the pandemic treaty to advance a One Health approach. So I don't, hold on, I need to be a good facilitator. I see a hand, so I see Mark Jones. If you want to, hopefully you can turn your camera on and speak. There you go. Hi, Mark.
Good morning. Thank you very much for this really interesting presentation. It's something that we've been following. My name is Mark Jones. I work for the Born Free Foundation, a wildlife and animal welfare NGO based in the UK. I just wanted to ask the panel how they see considerations of animal welfare fitting into this to the One Health process, particularly following the adoption at UNEP 5.2 of the resolution on animal welfare, environment and sustainable development nexus, and what they see as you know, how UNEP views that. Thank you.
So I'll jump in and then I'll give Julian a few seconds to think about that, since he was our shepherd for the animal welfare resolution. And it is a shame. What I will say is OIE was not able to join. Obviously, animal welfare is very much a part of OIE's mandate, which we said all during the UNEA process. But we do have, for those who aren't aware, we do have this additional resolution we have not started work on, in part because, as we said originally during UNEA, UNEP does not have a particularly developed capacity to work on animal welfare. So our plan is to implement this resolution when resources come, is part of an intergovernmental assessment process following our standard rules and procedures, involving in many other stakeholders and experts on all sides of the issue. We have not secured those resources as of yet. But obviously, there is some the whole point of that resolution is to look at the nexus in sustainable development broadly. So not just through a health lens, but the nexus more broadly. And as I said, we have not yet embarked on that process, but I will turn to Julian, who could maybe add, or any of the other panelists, if you have something you want to add, but maybe Julian.
Thank you, Doreen. Yeah, I mean, I think one thing to point out from the resolution is that it does call. Remember, the resolution was actually adopted before UNEP formally joined the Quadripartite, but it does call for UNEP to work with the Quadripartite to implement it. And that is, once resources are available, what we plan to do, because obviously both on the side of OIE, where animal welfare is straight, as you've mentioned, Doreen, it's a core part of its mandate, as well as with FAO, which also does quite a lot of work on animal welfare. I think their expertise will be invaluable in implementing the resolution. I see that Barbara has her hand up, so perhaps, yeah.
Good morning, all. Just a quick comment to echo what Doreen has said. From one side, we need to understand that all these concepts are a shared responsibility. However, on the other hand, acting and working collaboratively in the Quadripartite, but also pushing countries in adopting this collaborative framework, which is the final aim of our initiative, also means to do well what you have to provide with your specificity. So, for example, for us, strengthening capacities of veterinary services, including, of course, animal welfare capacities, means not only work for them to share data, work in a more transparent way, cooperate with the other authorities, but also fill the mandate that they have to fill. Therefore, both animal health and welfare remain priorities for OIE and for veterinary services. And with reference to animal welfare in particular, there is an ongoing process for the revision and the update of the OIE standard that surely will lead to more complete frameworks with cascade and consequent training opportunities, and most of all, stronger standards. Over.
Thank you, Barbara. And I think with OIE, that's really important to note, because OIE is a standard setting organization. And that's a really important avenue for that, as is WHO. Some other hands or comments in the chat. I'm trying to multitask. I see we have the presentation loaded. No other comments. So we've given you a complete picture of where we're going forward. So I'll give you a few seconds to see if there's any other thoughts. We don't need to prolong the meeting if there's no additional comments. The next steps are very much to, we're taking feedback. Each of the 4 organizations has done something similar to this. And we are now collating that feedback from each of the 4 organizations' different governance structures to again do a final refining of this living document. And then our hope is to launch it in June collectively, and then to work on a more detailed implementation plan that gets down into the more specifics of what and how we will do things together, which will be the basis, obviously, for continued engagement going forward. So that is where we're at. But I see anybody else, this will be your last chance, or we've just or maybe what I will do, we've just stunned you with so much information. So what I'll do is I will just go around, because we had a formalized presentation, but I will ask the panelists, because you each had to present a different part, and I know you've practiced this and done this. We've done this as a group with different people coming out in and out for a while, but I will ask each of the panelists in, I do have one point, which is, what do you see as the greatest challenge and the greatest opportunity to implementing this, this plan? So I see some of you thinking, I'm watching your eye movement, so I'll give you a chance to, but if you could just offer a little bit of that. Barbara, you've raised your hand first, so you've let your colleagues off the hook, then we'll go around.
Yes, because we have, we are posing this question very, very frequently in these weeks. And so let's say that finding sustainable implementation mechanisms is absolutely the core of the problem, because when we present and discuss of this plan, the reaction is, okay, how can we do it? Where do we find the money to do it? So this is the challenge, of course. But I think that the Quadripartite has foreseen this since the very beginning, because both financial mechanisms and monitoring and evaluation framework are the next step. So the implementation plan will indeed address this issue and provide mechanisms for not only for sustainability, but also for understanding the impact of what we will do and the opportunities we will create. The opportunity for me is, from one side, to use and optimize and harmonize the hundreds of tools that are already available. You see, all of us in the presentation have highlighted this building on the existing, which doesn't mean that we will not develop new, because there is a need of new, otherwise we wouldn't have made the effort. However, it's important to see that a number of programs are already available, and sometimes they do travel along different pathways, and there's no coordination. So the opportunity is to optimize not only at quadripartite level, but also for countries, to optimize the capacity to integrate the different tools according to the country needs, and the opportunity to share in platform best practice, good practice, implement, create frameworks for benchmarks, and try to improve with good practices. So I see an enormous opportunity that will sure bring to new issues, new things, new framework, but we already have a lot, and we have to use what we have done until now. And we have to also, as organizations, to work together for maximized use of what we have already created. Over.
Thank you, Barbara. Simone?
Yeah, thanks. So I would like to echo what Barbara said, and I think how to institutionalize this multi-sector coordination is a big challenge. Dealing with different stakeholders and understanding what are the common priorities, it doesn't mean that for example, one stakeholder at country level will have to stop doing other things, but how to find the common priorities and how to institutionalize this multi-sector coordination. I think it's one big challenge. And in terms of opportunities, I think that once we can have this multi-sector coordination in the countries, we can leverage the use of the resources. in terms of use of laboratories, human resources, avoiding and finding where we have some overlapping actions and finding where are the gaps and to reorganize the resources and reinforce the use and strengthen the resources, not only human resources, but also financial resources in the country. So I think that will be also an opportunity for countries to revise those.
Thank you. So I have in order, I have Julian and then Tim and then Katrin. Go ahead, Julian, then Tim.
Thank you. Yeah, mine is actually also along the same lines. It is the challenge of collaboration and coordination across different organizations with different priorities. And this I'm not saying about these 4 organizations, but any organizations that that work on One Health, say at the country level. But I think that is, and I think as Simona said, that is also the opportunity, because if we manage to crack that nut, we will be able to demonstrate the value added of One Health. What we might not ever be able to demonstrate is, I mean, I think certainly from UNEP's and I think from everybody's perspective, prevention of health crisis is what we should always try to aim to do. But that's something that is very difficult to demonstrate. In fact, every time you wash your hands, you're potentially preventing a pandemic. You just don't know, right? So, but anyway, I think it's both the challenge and the opportunity. Thank you.
Tim.
Thank you. And speaking of challenges, the challenges of going forth means that most people already said what you were going to say, but I'll just have to echo my colleagues. And this, particularly with Julian, I think this challenge is exactly, it's both the challenge and the opportunity, because this is the first time that it's good that we've formalized our, it's always good to have formal relations and, it helps grease the wheels and move things forward. But with all of the, existing work, most of this work in the Joint Plan of Action would have happened in some way or another in all of our organizations. But now it's being linked through this narrative and it's being pushed forward together. And that doesn't also detract from all the work that we're doing that is mandate specific, such as we were talking about with animal welfare and things like this before. So I think that is, for me, this is the big thing and the big added value, that we are linking all of these existing initiatives and activities and tools. We'll develop new ones when we feel that we need it. But then, so that's I'll call that the opportunity. But then the challenge is exactly, okay, then what are we doing all of this for? And then how are we going to benefit members and countries and actually on the ground? Because we can create all kinds of frameworks and tools and things, but if it's not working the coordination at country level, then we need to reevaluate. But I think we're on a very solid, much more of a solid ground than we've been on ever, to be honest. And I think we have a lot of work to do, but I think we're heading in the right direction. Thank you.
Great. Katrine, before you go in, another part of this that I just wanted to emphasize is also, yes, we're talking about 4 organizations, but we're talking about 4 organizations with a very broad and sometimes very deep networks. And I think that's the other opportunity. It isn't just about what we can mobilize within our 4 organizations, but then using our networks and connections to further catalyze action. And again, frameworks are great, but it's about those frameworks realizing real benefits on the ground, including for really the countries that are the most vulnerable to these complex health risks. So Katrine, please.
Hi, I'm sorry, I'm here a bit late on behalf of Bernadette Abela-Ritter because she couldn't make it, so I'm sorry if I'm too late. I wanted just to say I agree with Barbara for the sustainability part, because also when I think about our action track, which deals with the endemic diseases that usually have little attention because they affect the communities with little political influence or resources in rural areas. So there, the scaling up of all the activities is a big problem, because you have to gain the traction to have a coordinated approach that goes beyond single pilot projects, but it really has the scaling up part. And to find the incentives for the different sectors is really a challenge, because why would the livestock sector or farmer care if their animals are not affected by a disease, because it's an endemic disease that then has more the human health side, but they would have negative consequences because their carcasses would be, for example, destroyed or anything. So that's a big thing, the scaling up and to find the incentives for all the different sectors.
Yeah. I think the other point, you know, when I was first describing what One Health is, even to some of our member states, you know, One Health is like a piece of string. I either use the string analogy or the elephant analogy, right? Depending on an elephant, if you're holding the trunk, that's what One Health is to you. If you're holding the tail, that's what it is to you, but it's all of those things. And I've been in a few country level conversations where you realize people think they're talking about the same thing, but they're not. And I think that's the challenge too to this cross-sectoral dimension is you have to actually start from framing the problems together across the sectors. It isn't simply you define your goal and your problem in human health and you do it in animal health and you do it in environment health, and then we try and see where it overlaps. That's the least common denominator approach. That's not what we're going for. I think what we're going for is how do we understand the common challenges? How do we map the mandates? How do we map the resources? And then find something greater than just the least common denominator. But it does mean having a common understanding and sometimes a common language, which can be very hard across disciplines, across institutional cultures, and of course across just, you know, global cultures and cultures in general. So I think that's another aspect that certainly UNEP is looking at in our preventative investments is let's make sure we're starting from the right place to avoid confusion further down the road. So I don't see, I see some thanks, but I don't see any other questions from the group. So I think with that, we don't need to, we're all very busy people. We want to just thank the panelists for all presenting. Thank you to the member states who came. This is a topic, you can hear the passion in this group. We know that this is hard. We know this is harder to do things cross-sectorally and collaboratively, but we absolutely believe that this is the right way to get at these complex, wicked problems. And so we are all invested, even the partners who couldn't make it on here. And so I just want to say thank you to everyone who attended. Yes, the presentation is, I believe, already uploaded further up the chain. There's a question for that, Anja. So if you
actually, can I just say, Doreen?
Yeah.
No, it will be sent by email. I've confirmed with Governance Affairs that I wasn't able to actually upload it to the Teams, but it will be sent by email.
So you will get it by email. Sorry, we have technical problems there. So with that, no other comments or questions. Please thank you for your time. If you have any further follow-up or you have a thought afterwards, particularly from our UNEP member states and representatives, please, you can reach out via Governance Affairs, Julian, myself. If you have a thought after, oh, I wanted to say that, or I wanted to ask that, please feel free. But otherwise, we will be launching this plan collectively and continuing to move into implementation to see how we can have greater impact and really have the One Health approach be something that solves complex development challenges. So thank you. And have a wonderful, it's a great way to start the week on such an important topic. So Ulf, do I have to go back to you, or do you wrap it up, or do I wrap it up?
I think Ulf had to leave actually.
So then we're wrapped up.
Yeah.
Thank you so much, and reach out and you will get the presentation.
Thank you for the opportunity. Goodbye. Bye.
Bye.
Thank you, colleagues. Bye.